Paper and pencil, mask and gloves. If you want to know the information you need to start school safely, stay tuned. This is Dr. Batts, and as you all know, it is the weekend before we start school in Texas. And I can tell you, I am a lot of things. I am a brother to a teacher in North Carolina. I am the father to two young children, a 9-year-old and a 12-year-old that'll be attending school, and the husband to a school nurse. One thing that I'm nervous. Despite medical knowledge and knowing what I know, one thing that the coronavirus has shown me is what we don't know. And one thing that I don't know is, how do we stay safe sending our kids back to school, assuming that they'll practice social distancing, keep their mask on, wash their hands appropriately? I took those questions and moreover my concerns to a friend of mine who is an expert in pediatric care and known locally, not in San Antonio. I went all the way to Louisiana to get this expert and just to make me feel better. And I felt like our conversation would be something that you all could benefit from. We're going to talk now, and without any further ado, I want to introduce Dr. Brian Despanos. He is a pediatrician in Louisiana who specializes in a lot of things, but his whole goal is to keep people healthy. So we're going to transition. We're going to see him pop up here in a second. Hey, doctor, how are you?
I'm well. Thank you for having me, Dr. Batts. Good to see you.
Good. Well, you mind telling us a little bit about yourself, and I'll get things adjusted on my end, but I just want to let them know a little bit about you.
So my name is Brian Despanos. I'm from New Orleans, Louisiana originally, born and raised there. Went to LSU for undergrad, medical school at Meharry Medical College, and back to Children's Hospital for my residency, and completed that and started to teach with LSU's med school for about 7 years in Baton Rouge, Louisiana, and then opened up private practice. And I've been in private practice about 15 years. And the last 5, I joined a group practice. So I've kind of seen every genre of the pediatric practice. I love them all. Education is my goal. I'm not educating so much medical students and residents anymore, but I want to educate my parents and my patients.
Excellent. Well, I'm not a patient, but I am a parent, right? But I want to know, so what are your thoughts as we get, so if you could tell us just a little bit, I know you can talk about volumes of research, but what have you seen in terms of the coronavirus or COVID-19 in kids? I know we're hearing that kids aren't at risk or the kids' risk is low. What's been your experience with that?
Yeah, I would agree. I think the national data has kind of held up, as well as the international data, that school-age children, we're talking 6 to 18, 6 to 19, have been relatively unaffected. I don't want to say that they never have disease. They do, they catch it. But overall, compared to adults, they only make up about 7% of the nationwide cases here in the United States. And they only attribute to 0.1% of the deaths overall. To put that in perspective, about 64 kids die a year from the flu. And in the last 5 years, we have not had as many deaths with coronavirus as we've had the flu each year. And that's just to kind of put a little perspective on it. But the medically fragile children, I do want to mention this. We are not considering them at this point. We are talking about our healthy, immune competent kids going back to school. Anyone with immune issues and blood issues, any thyroid issues, anything that would compromise your immune system like a chronic disease, we want to be very cautious with them, putting them back into a communal environment. Because as we know, Doc, kids are very social, and it's difficult to keep them from each other and from touching each other and hugging and interacting. So, but that is part of the growth and development we love of them. So,
wow. I mean, that is a challenging undertaking, to say the least. I mean, just in going to the park, it is, as you said, this socialization where kids learn how to interact, kids learn how to solve their problems. And I will say, hearing you say that the risk is relatively low for, I guess, major events. And we'll talk about, I guess, one or two of those a little later on. But because that risk is low, should I not be concerned? I mean, I almost took up homeschool, which I think is a great strategy. But I know for my wife and I, it was just too difficult. We couldn't do it. What should be my concerns, or how are schools going to make our kids safe or provide those opportunities?
That's a great question. And that's, I think, what all parents are concerned about. And some of the kids I've had over the past 2 weeks, Dr. Batts, felt like I was on call 24/7. I've been getting calls and texts from parents and patients really concerned about returning to school. So as in Louisiana, we have already begun school, and there are multiple models that are out there. We have a hybrid where they will go to school sometimes and have virtual learning. There's a full virtual tract. And then there are some schools like our charter schools and then our Catholic schools who have chosen to reintroduce kids together. So we will be gathering data as we go through this. We do have some data to go on from Arizona, from Georgia, and then internationally also. So that the mitigation issues are big. So we have to make sure and ensure that each school district is putting in place, of course, the social distancing for 6 feet, the washing of the hands for 20 seconds, the wearing of the mask, all important. Other strategies that they are taking are cohorting kids, kind of putting kids with one teacher and having them track throughout the day instead of changing classrooms. They're also minimizing the size of classrooms. So trying to utilize spaces that may not be used for educational purposes in the school just to expand classroom size. So that's been effective as well. The other two big things are to develop a proactive plan if you have positives in the school, whether it be a student, whether it be a teacher or an administrator. If that plan is in place, we will know what to expect. And when it does become positive, we're not running around fearful. Okay, so the biggest issue is kind of having parents ask the right questions and to have an open line of communication.
Thank you, Dr. Despinasse. That was a great start to our discussion. But as you mentioned, I have many more questions. Throughout the week, we'll be highlighting some of these questions, such as, are masks effective in kids? What are some other specific issues that affect kids with regards to coronavirus? And what are some strategies moving forward that they're using to decrease the virus both locally and nationally? If you'd like to learn those, stay tuned.